Hi, welcome to 5 Minute Videos review for the NCE, and today we are doing some and we are going to be covering subcategory G, which is end of life issues. Now, when we talk about end of life or death and dying, that can be, again, it can be a spectrum of things because not everyone passes away in the same manner. So for you may hear the word end of life, or sometimes you may hear the word palliative or palliative counselors. Those are counselors that work with individuals or their caregivers or family or loved ones that are going through that stage. So many people are understandably vulnerable and scared, depending on the illness or the diagnosis. It can be very challenging for some, especially if it's not expected, or if it's something that others weren't prepared for. So, with the end of life concerns, as a counselor, you should understand that there is a very wide spectrum. Um, whether it's planned or unplanned, whether it's trauma, or whether it's the normal aging development, whether the person going through the end of life is in the setting. Do they choose to stay at home? Do they choose to be in hospice? What type of setting, what type of finances, do they have a will? All of those are important questions to consider. It's also important to consider that end of life or palliative counselors, it's a team effort, and many times there are, the medical professionals, you have the nurses, you have the doctors, then you could have like a clergy if there's religious or spirituality background. um but with the palliative or end of life counselor, their focus is on the grief process, or understanding what that looks like. So for many end of life decisions, um, many times it's about that support network. It's about having that compassion, and communicating that compassion so that others are able to express some of those feelings, and some of those um, you know uh, 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 emotions that many times are so evident with the end of life decisions. Also, a growing theme is dying with dignity. Many states, I know Washington, for example, they're passing laws where people are now making the decisions as to how they want to pass away. So in the future, you may see more of that, because that is becoming something that many individuals are advocating for. And it's important to understand that, again, it's a huge spectrum. It can be frightening and scary for many because many have never been through um, the end of life decision. So for many, whether they're in shock, or they're going through kind of the Dr. Kubler-Ross's grieving stages, they really don't understand a lot of it, and it can be so overwhelming for many. So that is just something to keep in mind and understand whenever we're talking about the end of life decisions and care for individuals.